Good evening, ladies and gentlemen, and welcome to yet another program of Pratignja. We are going to start, or we are going to introduce the new program of Pratignja called Ritusameeksha today. Before we start, let me just give you a brief idea about what Pratignja is. Uh, Pratignja was, we started Pratignja in 2020, and this is a platform where we have always tried to bring those kind of subjects that a practitioner can use in his or her career and make a specialty of its own. So this is going to be one such program called Ritusameeksha. It is going to be on Ayurvedic gynecology and obstetrics. I'll get into the details later on. So I'll just give you a small introduction of what Pratignja is all about and what were the previous programs of Pratignja for those of you who are new to this platform. So this is an introductory session that we are going to have today. Today we have eminent teachers who will be giving you an idea about what they are going to teach in this program. I'll come to each and every one of the teachers later on. Uh, Again, I just want to tell you the course fee, we have kept it as 3499 for all the new participants, and for all previous participants of Pratiknya, we have kept it as 2499. It is going to be a 14-day class, 28 hours of classes. All the details will be given later on. Please be patient. So this is this is a program that we are going to start tomorrow. It is Ayurvedic cosmetology, trichology, and product making. We are going to start it tomorrow. It is going to be a 29 days class, and this is going to be the third batch of cosmetology for us. This is actually the first batch of cosmetology, the first program, in fact, the first program that we conducted in Pratignja. We had a second program, Kerala Panchakarma. In fact, we are having currently the Kerala Panchakarma program is ongoing from last week onwards. This is a program on Agni Karma, a program on Uttaravasti, aromatherapy, SOPs, product making, cosmetology, trichology in Ayurveda. Ashana is a program on the Ayurvedic diagnostic skills. Vastikarma was on Vastikarma itself, and Subalyam was on the Bala Chikitsa aspect of Ayurveda. Ritusameeksha, this was our first batch of Ritusameeksha. We have had immense support from the community, Ayurvedic community for this. So we are going to have the second batch now. Sparsha is a program on Ayurvedic dermatology. Rudhiram was a program on Rakta Mokshana. Kerala Panchakarma, the second batch. This was the second batch of cosmetology that we had. Brihat Saptaha was a program on all the Brihatrais, and we had 17 of eminent scholars for that, as teachers for that. Agnikarma, second batch. This is Art of Infertility Management in Ayurveda. Uttaravasti, second batch. Aromatherapy, SOPs, product making, cosmetology, trichology in Ayurveda. This is the second of that. Niramaya was a program on Ayurvedic rheumatology. Meha was a unique program on diabetes and Ayurveda. Sirajam was on varicose veins. Prakrishtam was on the basics of clinical assessments of Prakriti. This is actually, as I told you before, this is the third batch of Kerala Panchakarma, which is currently going on. We just started last week, and we are going strong. So thanks for all your support on that. This is the cosmetology that we are going to start tomorrow. It is going to be, from 6 p.m. to 8 p.m. From tomorrow. It's 29 days class. And now we are here for this program, the introductory session on Ritusameeksha. I'll introduce each teacher, and they'll be introducing the topics that they are going to take, so that there's no confusion. The student can know what they can expect from this program directly from the teacher. So that's a basic aim of this introductory session. So I hope you'll all be patient. We'll go first. Let me call upon Dr. Sithara Satishan. Dr. Sithara was a friend of Pratignja. She has been associated with us ever since we started. So let me give you a small introduction of Dr. Sithara, and then we can start the introductions. Dr. Sithara Satishan, Assistant Professor, Department of Prasutitantra and Striroga, PNNM Ayurveda College and Consultant Physician at Kerala Ayurveda Nilayam, Kavalapara. Former Assistant Professor at Ashtangam Ayurveda College and Consultant Physician various hospitals. She has an eminent academic track of being university topper in PG and college topper in UG examination and bagged prizes for paper presentation during her academic years. Completed a UG from Vishnu Ayurveda College, PG from Amrita Vishwavidyapeetham, PG Diploma in Yoga from Annamalai University, has published many articles, presented papers, and posters at various national and international seminars. She has also been a faculty of our own programs. So let me call upon Dr. Sithara Satishan for introduction of her topic. Dr. Sithara? Hello. Dr. Sithara? Gentlemen, kindly be patient. I think there is some network issues. So again, let me just tell you that Dr. Rahul will be posting a link to a WhatsApp group in the chat box. So if you are interested to learn more about this program, to know what are the curriculum and all the details, you can click on the link and join that WhatsApp group where all the details will be given. If you are late, if you want to send this to a friend, this video also will be posted in that group so that you can forward it to a friend who will be interested in this. So I hope Dr. Sithara is available. Dr. Rahul. Hello. Hello.
Hello. Am I audible?
Yes, doctor.
Okay.
Over to you.
Thank you, Dr. Shyam, for nicely introducing me to the Ritusameeksha session. So, good evening, one and all. Once again, welcome to the second batch of Ritusameeksha session. And I am extremely glad to be a part of Ritusameeksha once again. And as Dr. Shyam told, this is not the first time that I'm cooperating with Team Pratignja. And I always feel that happiness whenever I'm cooperating with the Team Pratignja, and I usually enjoy the freedom that they provide to the faculties. And so once again, I'm happy for that. And so, as the name suggests, the Ritusameeksha, in this 14-day online program, we are going to discuss, or we are going to have an interaction about almost all the gynecological issues that can happen to a woman during her reproductive life. I think we are covering almost all the topics, like almost all the gynecological issues of a woman. So it was a study conducted by the ICMR, and there it was stated that when they noticed the prevalence of gynecological issues among the women, almost more than 20% of the women face at least any one of the gynecological issues. So it is very important for us to know how we need to diagnose the gynecological issues, how we need to give the proper investigations, or how we need to suggest the proper investigation for the presentations given by a patient. And also, we need to know properly how we should prescribe in specific presentations. So the Ritusameeksha is going to give you all an idea about all this. So I will be mainly dealing with three topics. My first topic is dysmenorrhea. Second is the abnormal vaginal discharge. And third is the sthaniga chikitsa. And in this platform, I'm extremely glad to share this platform with the most eminent, brilliant faculties of PTSR, like Dr. Vijay Kumar sir is there, Mumta madam is there, Vahidah ma'am is there, Asmabi Dr. Divya Srinath. So it is going to be a great platform for all the participants, as we are going to get guided by the most eminent faculties of PTSR. They will be sharing their experiences, the case discussions will be there, and at last you are going to have a great interaction with Dr. Vijay Kumar sir. So coming to the point about my topics, the first topic of mine is dysmenorrhea. You all know dysmenorrhea is the painful menstruation, and we all might have seen more than 2 or 3 cases coming to our daily. Coming to our OPD, having a presentation of painful menstruation. So first we need to know what is dysmenorrhea and how we need to differentiate between primary dysmenorrhea and secondary dysmenorrhea. And also we need to know at what time we need to prescribe a patient an investigation regarding dysmenorrhea. And when they come back to us with the investigation, we should have a proper idea what we are going to suggest to this patient. Based on the prakriti of the patient, based on the presentation of the patient, first we need to analyze in this dysmenorrhea, what is the major dosha associated? What are the associated symptoms other than the painful menstruation? So it is not the same for all the patient. For each patient, the prescription varies. For some, we'll be prescribing Gandharva Hastadi Kashaya. For some, we'll be simply giving Abhayarishta or Jinagarishta during the menstrual days. For some, we need to go for much more therapies. So we are going to go through each one. Then, secondly, we'll be describing about the abnormal vaginal discharge. It is known to all of us that a woman is going to face a discharge. That can be a normal discharge or can be an abnormal discharge in some point of her life. So when a patient with a discharge come to us, we need to know whether it is a normal discharge or whether it was an abnormal discharge. And in case of the abnormal discharge, again, we need to know whether it is like a leukorrhea pattern or whether there is a severe infection associated with it. If you feel it like it's an infectious pattern, we need to know what type of infection it is. What are the necessary investigations you need to suggest to that patient? At the correct point of time, you need to suggest the investigation. Otherwise, that is going to end up in severe cases like the pelvic inflammatory diseases, or it can even end up in a peritonitis-like condition. So we need to know exactly at what point of time we need to suggest for an investigation in an abnormal vaginal discharge. And when the patient comes back to us with the investigation report, again, we need to know how we are going to tackle the situation. If it is a fungal infection, we have to manage it in a particular manner. If it is a bacterial infection, the treatment protocol varies. If it is an STD-like condition, again, the treatment practice varies. And even the abnormal vaginal discharge, it can be due to a very simple cause, as well as it can be due to a major complicated pathology like the cervical cancer or the malignancy-like issues. So if you are not diagnosing it at the proper time, we are simply complicating the patient. So we need to know in detail about each of these conditions. And when it comes to the Ayurvedic point, we need to know how we need to correlate this presentation with our doshas. When you need to give a Vada-based treatment, when you are going to give a treatment based on Kapha, how you need to select the drugs or the medicines based on the doshas, whether you can manage this case simply by internal medicines or whether you need to go with the Sthanika Chikitsa or the therapies, or whether you need to give some Shodhana therapies initially. So all this is very important. So when it comes to gynecology practice, it is not only prescribing some medicines internally to the patients and managing the patients. No, it is not like that. There are some very complicated situations where we need to do the Shodhana therapies as well. Sometimes after that, we have to continue with the Sthanika Chikitsa. So all this is very important. And that's why I'm dealing with the third topic, the Sthanika Chikitsa in gynecology practice. In that, we will be discussing about almost all the Sthanika Chikitsa one can do at an OPD level. It is very easy actually. We need to have and get experienced. So only if you do something, we are going to get an experience. So we'll be discussing how we can do the Sthanika Chikitsa at an OPD level. What are the easy measures or methods of doing the Sthanika Chikitsa? In what all cases you need to do the Sthanika Chikitsa? With what all medicines you have to do the Sthanika Chikitsa? whether the Sthanika Chikitsa is going to give you a fruitful result or whether you need to refer the patient. All this is very important. So in my sessions, I'll be going to deal with these three topics, and I hope I am going to give you or explain to you everything in detail. And throughout my presentation, I'll be giving you some case discussions and my experiences I'll be sharing. And I hope the Ritusameeksha is going to be a very good platform for you to excel in the gynecology practice. So let's join together for Ritusameeksha, learn together from Ritusameeksha, and I hope we all can meet again on February 15th in Ritusameeksha. Thank you all.
Thank you, madam, for that wonderful introduction. Thank you for that. Thank you. So let us move on. Ladies and gentlemen, please make a note that Dr. Rahul will be posting a link to a WhatsApp chat in the chat box, WhatsApp group in the chat box, and you can click on the link and you can join that WhatsApp group where all the details of this program will be given. If you want to learn more about this program, the curriculum, the brochures, everything will be posted there. Even if you have just come in late, if you want to listen to the teachers again, you can go there and listen. This video also will be posted there. So let me go to the next teacher. Without further ado, we have Dr. M.A. Asmabi. Let me give you a small introduction of Dr. Asmabi before I hand over the mic to her. Dr. M.A. Asmabi, currently working as a medical officer under ISM Palakkad, completed her BAMS and MS Prasutitantra from Government Ayurveda College, Trivandrum. She has more than 10 years of experience in government service and practice in gynecology. She has treatment experience in gynecological disorders, infertility management, PCOS, endometriosis, etc. She has took seminars and public awareness classes on the same. She is also working as state convener of RITU project, the Adolescent School Health Program. She has been awarded Bishop Pratibha Award by AMI. Legend Pharmaceuticals. She has published articles and many articles and in magazines and journals. So without further ado, let me call upon Dr. Asmabi.
Yeah, it's okay.
Over to you. Yes.
Is it clear? My voice
Yes.
is clear?
Yes,
It's
ma'am.
okay. Let me share the screen. It's a short description about my topic. I hope it is visible.
Yes, ma'am.
Yeah, it's okay. First of all, I would like to thank the team here, the Pratignja. I think today I'm the first session because so many other invitees are there. But even though this is my first session in this team Pratignja, the topic given to me is the Panchakarma practices in gynecology. So let us coming to the topic. Just brief introduction. What are the things I'm going to tell? I will be presenting about the Panchakarma practices in gynecology is the first topic. Here we know in our clinics there are so many cases are coming, including infertility, PCOS, and so many gynecological conditions may come to our OPDs. But we know the Panchakarma is the gem of Ayurveda therapy, including this so many whatever the facilities is available in our clinic. It may be in OP levels or it may be in IP levels, but even though we have to practice very fruitfully. So that how we are selecting these conditions like Shodhana Chikitsa and also Shamana therapy. If we are planning to a patient for giving the therapies, what are the basic concerns of that case? Maybe like in infertility cases, the chronicity of the infertility cases, it may be 4 years, 10 years, and like that. So whatever the conditions we are focusing while selecting a case for doing first Shamana therapy or Shodhana therapy. Actually, we know in Prabhuta dosha, we are giving Shodhana therapy, and also, but we are coming to in patients, or we are prescribing some protocols. What are the factors we are considering? The BMI of the patient, a menstrual history, if it is a chronic amenorrhea or otherwise it is chronic, then other PCOS or like that. Then what are the importance of Shodhana Chikitsa? Always we know Anatesham Apunarbhavatvat, and also the elimination of the dosha, dhadus, and especially the Srodoroga to clear the, otherwise the Srodoshodhana is the important function we are doing through this Shodhana Chikitsa. And then the different conditions, so many different conditions like we explained, this infertility, PCOS, etc. are coming to our OPDs, like obesity may be there. Then while we are prescribing a protocol to a patient, we are planning a protocol. Then what should be the medicines? What are the dosages? From which medicines we have to start, or which dose we have to start, like that. We have to discuss through this topic. Then when to start and when to stop. For example, if we are planning a Rukshana therapy, then when we have to start this Rukshana, or when we have to start the Snehapana, then what will be the doses? Especially if you're planning the Shodhana therapy, here come the Snehapana, Vamana, Virechana, Vasti. Vasti, I think different form of Vasti we have to practice in our gynecological area, including Anavasana Vasti, Niruha Vasti, Uttra Vasti, and even Nasya also. So in the practice of Snehapana, we are very commonly practicing it. But even though in gynecological conditions, which Thaila is good, or Kruda is good, or in combinations we have to use. So there are so many doubts regarding the Snehapana and the dosage of Snehapana. If we are using Thaila, then from which dose we have to start and which days we have to end up. Is it completely, or the Rukshana is completed up to 7 days or 9 days, or while prescribing this Snehapana? Actually, according to the conditions, if you are prescribing, what are the mode and what are the methods we are selecting here? And then if we are next step, we are planning for Svedana. Then if you are planning Vamana, then how many days we have to do Svedana? How many days we have to do then Utkleshana? These are the things, the basic things, but we are very important in practicing this Panchakarma. Then in case of Vamana also, what are the medicine? Is there any special combination in the case of this gynecological practice? Or otherwise we are commonly, as in Panchakarma, we are doing these Vamana procedures. Is it the same in the gynecological practice also? Then coming to Virechana is also important. Is there any type of whatever the medicines in gynecological conditions, or Snigdha Virechana, or in whenever we needed to do the Snigdha Virechana, or in other conditions, or which conditions we have to do this Ruksha Virechana? This have to be, we can discuss in detail. Then coming to Vasti, we know in Vasti considered as the Ardha Chikitsa of in the practice of Ayurveda, but I concern Vasti is the Purna Chikitsa in the practice of gynecology, and also in most of our conditions. Here the Anivasana Vasti, even though what are the medicines and what conditions we have to select, then Niruha Vasti, then different combination. We know some medicines we are adding some Dravadravya, Kalka, and also Sneha. These are medicines we are actually adding, but in different permutations and combinations we have to use in if it is in fibroid, or if it is in PCOS, or if it is in ovarian reserve is less. Then how these conditions, what are the specific Vasti combinations or Niroha combinations, like how we have to practice. Then coming to the Uttravasti also, there is a dispute, and we are not actually in our common clinical practices, we are not very commonly practicing. Maybe there is a dispute in clarity of classical references, fear about the complications, and ignorance regarding the right technique. I think if we are experienced, it's very easy to implement, and it's very in most of the cases we will get wide acceptance in the practice of these so many gynecological conditions. So this is my first topic regarding the Panchakarma and also the Shodhana therapies very commonly practicing in gynecological disorders. And the second topic given is the clinical diagnosis and management of endometriosis and uterine fibroids. This is also a vast topic, but even though considering these factors, we know in our OPDs, there are so many patients are coming with different reports like uterine fibroids. Madam, is it the size is problem, or what are the site is creating any problems? If it is very much large size, then what will be the complications? So etc. We are dealing through these sessions. We know different type of fibroids, although even though in our clinical practice, how we are correlating as per dosha predominance. And then some experiences regarding this infertility and fibroids may be associated with some bleeding conditions, or congestive dysmenorrhea may be there. So according to these presentations, I will be planning to share some case reports also. Then next is the endometriosis. Here we know the endometriosis is one of the important reason. I think in our OPDs, the PCOS, I think the most common presentations to get the infertility cases. The second one I feel that is the endometriosis. Here also one of the main reason for infertility. Moreover, the quality of the life in women also affected due to this endometriosis, because due to the severe pain and sometimes heavy bleeding, it will be very difficult to tolerate these conditions. So how to diagnose the this endometriosis, and what are the proper investigations we have to do in such conditions, what are the clinical presentations, and what's the prognosis. Here also we have to discuss, because whether it's needed to do the surgery or otherwise, how to an extent, to what extent we have to treat the cases, and then what the samprapti of the disease, and what are the possible intervention, and also in regarding this endometriosis that I will be discussing. Thank you. Thank you for this opportunity. These are the two topics given for me to the presentations. And I hope it will be useful for you through the all the best wishes for this Ritusameeksha team, and also for this Pratignja. Thank you. Thanks once again.
Thank you, madam. Thank you. This is exactly what we wanted from the teachers. Teachers will tell the precise topics that they are going to take, so that there's no confusion with the students. So let me call upon the next teacher. We have Vijay Kumar sir now. So before that, let me just again tell you, Dr. Rahul is going to post in the chat box. He is going to post a link to a WhatsApp group. You can click on the link and join that WhatsApp group, where all the details of this course will be given. The curriculum, everything will be given. Okay, so if you just come in late, do not worry. This video also will be posted there, so that you can go and listen to the teacher once again and then make a informed decision. So let me now call upon Vijay Kumar sir. So before that, let me introduce Dr. N. Vijay Kumar sir to you. Professor Dr. N. Vijay Kumar, Professor, HOD and Superintendent, Government Ayurveda College Hospital for Women and Children, Trivandrum, Kerala. Graduation and post-graduation from University of Kerala with 35 years of clinical experience and 28 years of teaching experience. Currently PG Board of Studies member, University of Kerala. Well known in the field of infertility management, resource person and moderator for many national and state level seminars, workshops, CMEs, ROTPs, and speaker in various medias, presented several papers in national and state level seminars, and published several scientific articles. So without further ado, let me call upon Dr. N. Vijay Kumar sir for his introduction of the topic. Vijay Kumar sir.
Hello.
Hello sir.
Can you hear?
Yes sir. Over to you sir.
Visualized?
No sir, we are not able to see sir. Your video is off, I think, sir.
Okay.
Yes, sir. Now it is fine.
Now, yes. Okay.
Yeah. Over to you, sir. Thank you.
Okay. Right. Hello. Respected dignitaries, good evening, one and all. First of all, I would like to express my good wishes to the Ritusameeksha online certificate course regarding clinical exploration of gynecological disorders. You see, as far as the present situation is concerned, we people can contribute so many things for the patients through various branches of Ayurveda, specifically for various gynecological conditions. Actually, we are running parallel to modern gynecologists in a healthy way. Here, we are getting number of gynecological referrals from different modern gynecologists from various parts of Kerala with all respects. Amongst which, endometriosis, adenomyosis, polycystic ovarian disease, diminishing ovarian reserve, including low AMH and AFC, and also pre-malignant lesions of cervix, cervical intraepithelial neoplasia or CIN disease are most common. You see, CIN disease in which the cellular changes are confined to the epithelium but do not extend beyond the basement membrane. Thus, it remains the non-malignant state. You see, women usually present to gynecologist with one symptom or a group of symptoms. The symptoms of different gynecological and non-gynecological problems overlaps. So it is very difficult, or it is not so simple to arrive at a correct diagnosis. One typical example is chronic pelvic pain or CPP. You see, chronic pelvic pain is a challenging problem due to its complex etiology and poor response to treatment. It requires multidisciplinary approach involving a gynecologist, urologist, gastroenterologist, psychiatrist, and sometimes other specialists for proper management. What is chronic pelvic pain or CPP? It is defined as non-cyclical pain of at least 6 months duration unrelated to menstruation, intercourse, or pregnancy. The pain should involve pelvis, abdominal wall at or below the umbilicus, lower back, and or the buttocks. You see, the chronic pelvic pain may be caused by gynecological, urological, gastrointestinal, musculoskeletal, neurological, or psychosomatic conditions. CPP, one main thing, CPP must be differentiated from dysmenorrhea, which is related to menstrual cycle. That is, CPP is unrelated to menstrual cycle, but dysmenorrhea is related to menstrual cycle. I am not going to explain all the or expand all these things because the opening ceremony, several eminent resources persons are incorporated this program, like our Madam Dr. Mumta, HOD in the Department of Prasutitantra and Striroga, and Principal SDM Ayurveda College, Udupi. Hello, Madam. You became the principal. Congratulations. Then Dr. Vahidah Rahman, Dr. Asmabi, Dr. Divya Srinath, all are my students, and Dr. Sithara Sudhishan, usual presenter. Then I have not seen the name of usual presenter, Dr. Pradeep. Then my good wishes to one and all. Also, I wish to congratulate Dr. Rahul, the backbone of Pratignja and the whole crew. Again, I wish to express my sincere thanks for getting me a chance to join this program. Nothing more to tell. I am concluding.
Thank you, sir, for that wonderful introduction. Thank you for that. Dr. Pradeep was busy, that's why we couldn't get him this time. Okay, let's move on. We have Dr. Vahidah here. So let me give you a small introduction of Dr. Vahidah. Again, previous our faculty. So Dr. Vahidah Rahman is now working as Senior Medical Officer at Government Ayurveda Dispensary, Pathanamthitta, BMS from Government Ayurveda College, Tripunithara, 1997-2002 batch, with first rank, MS in Prasutitantra and Striroga from Government Ayurveda College, Trivandrum, 2005 batch, working as ISM Medical Officer from 2006 onwards, successfully treated 1,757 infertility cases as on 7/3/2021. That was 1 year ago, almost 1 year ago. Awarded as the best doctor of Pathanamthitta in 2015, Bishak Pratibha State Award of AMI in 2016, Charaga Award of State Government 2017, conducted seminars all over Kerala, some parts of Tamil Nadu and Karnataka on various aspects of Ayurvedic gynecology, conducted webinars for doctors of Australia, UAE and India. So let me invite Dr. Vahidah Rahman for her introduction of the topic. Madam.
Thank you, Dr. Rahul. In the name of God Almighty and with the blessings of all my gurus from first letter to till now, respected dignitaries, my dear friends, a warm welcome to one and all. I am with very much pleasure to share my experiences in front of my respected guru, Dr. Vijay Kumar sir, my examiner, Dr. Mumta madam, my best friend, Dr. Asmabi, and my favorite juniors, Dr. Sithara and Dr. Divya, etc. They are in this. They are the faculties in this Pratignja team, and I congratulate the team Pratignja to select these practical-oriented subjects regarding the gynecological disorders, and which give more confidence in the young practitioners for practicing the gynecological disorders well, because as long as Sthri is there, sthreerogas are there. So the gynecology is the most valuable thing in the fraternity of Ayurveda for practicing well. because Strihi Moolam Abadhyanam Strihi Rakshati Rakshita. When we treat a gynecological case very well, and we can give good help to the lady, that is why good health of the family and the society and all. In my class, in this Pratignja Ritusameeksha session, there are 3 classes, and first 2 class related with the antenatal care. First one is management of complicated pregnancies in Ayurveda, and second one is the antenatal care, Garbhini Paricharya in Ayurveda. As we all know, the complicated pregnancies cannot manage fully with Ayurveda, but we can prevent the complications with the Ayurvedic management. We can give good Garbhini Paricharya for preventing more complications, and we can understand the early signs and symptoms of complications, and we can refer the case, we can guide the case to prevent the most fatal complications related with the pregnancies. And we can give it good antenatal care which prevent all the complications and give a good help to the mother and good help to the baby, and preventing all the complications. In Ayurveda, we have lot of things to manage. I selected my PG course, that is Prasutitantra, because I suffered a lot in my antenatal period. So I selected this course for my PG, and it was my motto was that to study well about the Ayurvedic gynecology and to give the suffering females for the proper management and better care, etc. So with the help, the grace of God, and with the blessings of all my gurus, I can read more than now. The case is 1905, 5th case today born. So with Ayurvedic management only, and of course we can help some of the pupils, and they need the modern management or artificial reproductive techniques for the fertility. We can prepare them with Ayurveda for preventing for treating the Ayurvedic for treating the gynecologic disorders well. We can prevent so many complications, and we can improve the health of the lady. And my last class is related with the commonly used yogas in Sthreeroga. There are so many yogas which are not directly mentioning in the Sthreeroga Prakarana, which may be mentioning in other Vadavayadi Chikitsa Prakarana and Pandu Chikitsa, etc. But we can incorporate these yogas in the treatment of Sthreeroga wisely, because going their Balasruti and properties of the medicines, etc., we can wisely use these yogas. And there are so many home remedies, and also there are so many books in Malayala, that is Chikitsa Manjari, Arogya Raksha Kalpadruma, and Vahidah, etc., which gives us hint to treat with a simple medicines for almost all the cases of gynecological disorders. That we discuss in my last class, that is the commonly used yogas in the Sthreeroga. These are the topics which given for the Ritusameeksha program. I congratulate Team Pratignja for giving this confidence to the practicing young doctors with your classes. Almost all the classes that the Team Pratignja, which are all are practical oriented and gives much confidence in the young practicing physicians. And thank you once again, and Pratignja team, for inviting me as you are a permanent faculty now. Thank you once again, and most pleasure to see Dr. Vijay Kumar sir and Asmabi, etc. My favorite guru and my respected guru. Thank you, sir. Thank you all. That's all. Thank you.
Thank you, madam. Thank you. Wonderful introduction of the topic. Thank you, madam. As you said, this is what we do in Pratignja. We try to bring the practical or the career oriented topics as a subject, so that it will help the students in their career. So that's what we try to do. So we have Dr. Divya Srinath with us now. So before I hand over, just let me tell you, Dr. Rahul is going to post a link to a WhatsApp group which you can click and join, and all the details of this program will be given there. Also, the video that you are seeing right now will also be posted there, so that if you have come in late to this program, you can go again, listen to the teachers once again, and then make a informed decision. So before I hand it over to Dr. Divya Srinath now, let me just give you a small introduction of Dr. Divya. Dr. Divya Srinath J, BMS, MS, Prasutitantra and Striroga, PGDCR, BMS from Pangajagasturi College of Ayurveda, PG from Amarda School of Ayurveda, postgraduate diploma in clinical research and counseling and Ayurveda psychotherapy. Worked as a research fellow in infertility, a project on diminishing ovarian reserve, funded by Department of Ayush, Government of Kerala, conducted in the Department of Prasutitantra and Striroga, Government Ayurveda College Hospital for Women and Children, Pujapura, Trivandrum, Kerala. A specialist consultant in Sri Rudra Multi-Specialty Hospital and Research Center, specialist consultant Dr. Divya's Ayurveda Gynecology and Fertility Specialty Clinic, faculty of the course Diploma in Ayurveda at Rosario University, Colombia, South America, awardee of Research Excellence Award 2020 and Woman Researcher Award 2020 by Sheen International Russia. Published scientific articles in several international and national journals, presented papers in several international and national seminars. So over to Dr. Divya Srinath to present her topic. Over to you, madam.
Thank you, Doctor, for such a nice introduction. And first of all, I would like to thank for inviting me in this program, Ritusameeksha. And Doctor, am I audible?
Yes, Doctor, you are. Yeah, please.
And also, I'm so glad to work with my sir, respected Sir Vijay Kumar Sir, Mumta Madam, and my favorite, my seniors, Dr. Vahidah Madam and Dr. Asmabi Madam, and with my friend, Dr. Sithara Sudishan. And dear doctors, as we all know that nowadays we are getting more and more gynecological cases in our PD, because people are more preferring Ayurvedic treatment than allopathic treatment. And now we more cases, more of dysmenorrhea cases, or even with bleeding disorders or PCOD. Nowadays, after this lockdown, PCOD cases, especially in the puberty period, and or in the youngsters, PCOD cases are more rising, and also discharge issues or infertility issues. For all these cases, women prefer more Ayurvedic treatment. So if we are having a very good knowledge about the condition and how to diagnose the condition well, or what are the treatment options which are available in our classics, or our treatments, or even we had to know what are the probable investigation that we need to know to rule out a particular condition. So for that, we need to have a thorough knowledge of the subject, and we had to gain confidence in the subject. So this session, this 14-day session will enable you to attain a very good confidence in this practice. And if about this 14th session, I'm taking mainly 2 sessions. One is on the diminishing ovarian reserve, and one is on menopause. So as you all know, nowadays the infertility cases are rising. 1 in 8 women, 1 in 8 couple are suffering from this infertility issues. And nowadays, the couple come to you with claiming that they are having low AMH, or they were advised to have an IVF with a donor egg. So such cases are rising, or even they come to you, they want to improve the AMH, like that they will see. So for that, myself already worked as a former research fellow under the guidance of Dr. Vijay Kumar sir. We had observed more than 60 patients, and sir has formulated a protocol, and we done a study on that. So we had observed more patients on that. We had seen what all medicines are effective on this case, and what all the investigations we had to do. Usually they will say that a woman is born with a particular ovarian reserve, so we can't just improve the reserve. They were born with a definite reserve. So we had to see the reserve is assessed, the functional reserve can be only assessed by with AMH or AFC. So the total reserve, there is no such criteria to assess the total functional reserve. So in our concept, like avarana is there, or like if there is any like a hindrance in the total reserve to like show up. So in such cases, our management can be effective. And also we had observed that our medicines has an action to improve the FSH action on the follicle. So definitely it will improve the follicle quality. So we will share these some of the experiences which we gained from the project as well as from my treatment experience. And after this project also, I am like doing more and more research on these topics. So I will share with you, doctor, so that we can spread the knowledge and we can help more and more like couples to reduce their suffering and all. And second topic that I'm dealing is on menopause. So usually like in the perimenopausal lady come to an OPD claiming about their joint and muscular discomfort. So usually their menopausal symptoms we are leastly addressing, right? So these we had to change. So there are so many menopausal symptoms, like say about 11 menopausal symptoms. Some they will tell about hot flushes, or even the urogenital symptoms or the psychological symptoms. So nowadays it is observed, studies had done, because 80% of perimenopausal ladies are having psychological symptoms, but they are not given that much importance. So if a lady in the perimenopausal lady come to you, you had to ask about their this gynecological or menopause related symptoms also we had to address. And also they may have like symptoms like this prolapse related issues, or even the burning maturation or burn vaginal discomfort will be there. So we had to like give more importance to these areas, and we will share with the what all the treatment modalities we can give to these patients to reduce their symptoms. And sometimes the thing is that sometimes they are even not aware of the fact, because they are having these sufferings, but they are not aware that these are due to the menopause related issues. So we can change their attitude, we can give more awareness. And these class, especially the second part of this Ritusameeksha, I'm also so glad to inform that the first batch of Ritusameeksha, it was really a very wonderful program. And now and some of the students, like 3 or 4 students, are still in contact with me, and I'm glad to inform that they are practicing, they are very beautifully, they are practicing their gynec related practice. So that's also a very good thing I want to inform. And I hope doctors, this 14-day session will definitely help you to improve your confidence, and it will definitely support your clinical practice. And see you in the classroom. Thank you, doctors. And thank you once again, Team Pratignja, for organizing this session.
Thank you, Dr. Divya. Wonderful introduction by you. Thank you for that. We have Dr. Mumta with us now. Mumta, so let me go directly to her because I don't want to keep her waiting. Dr. Mumta KV, Principal, Professor, Department of Prasutitantra and Striroga, SDM College of Ayurveda and Hospital, Udupi. She has completed BAMS from AMV Hubli with gold medal, and MD in Prasutitantra and Striroga from BHU Varanasi. Took PhD from NIA Jaipur. She racked up Young Scientist Award in Kaumara 2006 in the international seminar held in SDM College, Hassan, and Outstanding Alumni by Association of AMV Hubli. She has contributed many research works to Ayurveda, published several articles in peer-reviewed journals. She served as a resource person for various programs. So over to Dr. Mumta for her introduction. Over to you, madam.
Hello, good evening, doctors. Thank you, Shyam. Actually, I'm outside, so my video may not be very apt. It's not very clearly visible. So the second session of Ritusameeksha, Shyam asked me to take several chapters. That is, one is on polycystic ovarian disease. If you see the current practice, probably when I was a student studying, hardly we used to get any cases of polycystic ovarian disease. But in today's practice, if you sit in your OPD, probably the very third case or fourth case, what you will be getting, that is definitely a case of polycystic ovarian disease. In the beginning days, we were taking the cases of, or we were having the cases which were mostly of Santarpanajanya pathology or obese polycystic ovarian disease patients with the classical triad, what we were getting like hirsutism, then obesity, then there would be menstrual irregularities. These cases we used to get. But nowadays, the cases are coming with the so different presentations, and even the disease, the polycystic ovarian disease in lean patients or lean polycystic ovarian disease incidences are also very much increasing. A survey in Belgaum, school-going children, has revealed that almost 60% of the students are suffering with the polycystic ovarian disease, wherein almost 50% of them are in lean category of polycystic ovarian disease. So obese polycystic ovarian disease is definitely a challenge, but it is not that challenging as we get in lean polycystic ovarian disease, because as it is said, the Samprapti is having all kapha meda nidhanas. At the same time, we can go with the treatment of kapha meda hara chikitsa, and it is easier for management. So with this line of management, we get a very positive results. So in the coming days with the polycystic ovarian disease class, in the first class, it is the general approach to polycystic ovarian disease, wherein the complex or intricate hormonal mechanisms which are giving rise to polycystic ovarian disease. At the same time, how we have to see the patients when they approach us. What are the factors which we have to interrogate with the patient rather than investigation? I give more emphasis for the interrogation with the patient, because I believe more in Nidana Parivarjana is Ardha Chikitsa. So if the patients are interrogated properly, and if we suggest them what is the right method of life, or if we modify their lifestyle, probably our half work is done. So with this, we can get the improved success rates, or even the recurrence rates can be reduced when we tackle or approach the patients with the Nidana Parivarjana as the initial line of management. Next, coming to various aspects of polycystic ovarian disease, how we have to go to understanding of polycystic ovarian disease, whether we can fit it into some prapti of obesity, whether we can fit it into Santarpanajanya Vyadhiya, or whether we can go into Avarana Samprapti, or it is Krasha Madhumehi, whatever it is, the entire details we will be getting to know in coming classes, future classes. Then my second disease is abnormal uterine disease, abnormal uterine bleeding, dysfunctional uterine bleeding instead. But I say abnormal uterine bleeding, when dysfunctional uterine bleeding topic is given, I believe the Asragdara, whatever said in Ayurveda, is a beautiful description of all types of abnormal uterine bleeding conditions. So one by one, what are the different causes of abnormal uterine bleeding? Maybe in terms of palm coin, we can take it as abnormal uterine bleeding. So if we palm coin, as the modern textbook says, that is the pathology of abnormal uterine bleeding. So this palm coin, how we can correlate it with the pathology or samprapti of Asragdara. So how Asragdara includes all the conditions of abnormal or the samprapti of Asragdara, we can explain with the all modern conditions which are giving rise to abnormal uterine bleeding. So all these things, and how we can classify them into different Vataja, Pittaja, Kaphaja kind of Asragdaras, varieties of Asragdara. Then we can also we will also see what are the chikitsa of different varieties of Asragdara. So all these things we will be discussing in the coming classes. So see you next in the classroom. Thank you.
Thank you. Thank you, madam. Thank you. Even if you are outside with family, thanks to all the family members also for this. Thank you, sir. Thank you, ma'am. So, ladies and gentlemen, that we have heard from all the teachers now. So we'll be we'll be taking few of the questions that if you are having, you can put in the chat box, and we'll go through all the questions whichever we can complete in the meantime. So I want to thank all the teachers for coming in today and explaining or introducing their topics to all. Thanks to all the teachers. So we'll be having a small session on question and answers that is regarding the course, not the subject, the course, because we'll not be able to cover all the questions which is going to be in the subject oriented. We will not be able to take now. So anything related to course you can ask in the chat, and we'll be able to answer all the this one. Let me just give you a idea. This will be a 14-day course, and there'll be 28 hours total. 6 faculties are there. The course fees is set to 3,499 for all new members, all new participants, and for the previous participants of Pratignja, we have kept it at 2,499. We'll be starting on 15th of February till 27th of February. The timing will be 8 p.m. to 10 p.m. So if you have any doubts, please do put in. As I told you, Dr. Dima, the course is going to start on the 15th of February till 27th of February. Okay, and there'll be practical oriented. These will be practical oriented classes. We have, see, I always tell this, but it might be a cliche. The word Pratignja means promise. So the only thing that we promise is that we try to find the best teachers for a subject. When we decide on a subject, the most time we spend is on the teachers, and these are eminent teachers from all around all around the country, and we are sure what you learn is going to give you a basic career path if you are interested, especially if you are just a BMS graduate and not specialized. Even if you are specialized, if you want to go into this one, this will give you a start. So this is that is what we are hoping for, that you can find a career path with our programs. So if you have any doubts, please do post in the chat. The recordings will be given for 6 months. So that is that is what we give usually, and how and everything we'll be deciding, or we'll be discussing, or we'll be letting you know once the class starts. So do not worry about that. Anything, if you have anything, any questions, you can put in the chat. Dr. Rahul, Dr. Anjana, if you have anything to add, please do add.
So nothing. All of you, please try to join the WhatsApp group because all the details regarding this course will be posted there, and even the video will be posted there. So please join the chat box posted in WhatsApp group posted in the chat box. Thank you.
Thank you, Dr. Anjana. So Dr. Rahul has posted a link to a WhatsApp chat. Please click on that, join the chat group, and you will be able to get all the details about this program, the brochure, even this video. If you have come in late for this meeting, this video also will be posted there, so that you can go back and listen to the teachers once again and make an informed decision. Please do forward this to your friends and colleagues who are interested in this subject, and maybe they'll also be they'll also be benefited from this. Yes, study material will be given in PDF form. If the teachers give us some materials, of course we will be giving or sharing that with the students also. Most of the things that we learn in this program will be in our text only. So daily timings, thank you, Dr. Hemant, it will be 8 p.m. to 10 p.m. Certified from no, it is not certified from any institute or any university, but what we are planning to do is, what we have in mind is, we bring in good teachers and they teach you a proper way to treat a certain kind of disease, and or certain kind of disorders, and that will give you a boost in your clinical practice. That's all we can promise you. Yes, we will be giving you a participation certificate. Yeah, so I hope that's it. Let's move on. If you have any further questions, you can contact us. Do not worry. This is the curriculum of the program. Again, we will be posting in that WhatsApp group. 14 days. Yeah. Now these are the feedbacks from our participants. The reason we show the feedbacks in each and every program that we have is because we take it seriously. We listen to them. We try to make corrections based on their suggestions also. So thanks to all the feedbacks from all the participants, or previous participants of Pratignja. If you want to learn more about us, please do visit www.pratignja.com, or you can email us at pratignja@gmail.com. These are the phone numbers that you can have, and if you have any doubts, please do reach us at these numbers. This is my personal number, 960-550-9999. Dr. Anjana Unnikrishnan 9446967638. Take a screenshot with your mobile so that you will not forget it. Dr. Rahul Jaishankar 812-987-6622. So if you have any suggestions, yes, Dr. Satyajit, we will be giving video recordings for 6 months. Okay, and we always leave our students with a small thought for the day, because every session is vital. The only place where success comes before work is in the dictionary. You have to work to become successful. So these are the partners of Pratignja: Dr. Anjana Unnikrishnan, Dr. Rahul J, and myself, Dr. Shyam. So this is our caption: keep learning and keep growing, because without learning you will not grow. So we are here to help you grow. I think that's it. So thank you all for coming. Thank you all once again, and please do forward this to your friends and colleagues who will be interested in this topic, and help us reach them also. Okay, thank you all. Good night.